Question 1. You are using a token board with a client. The client earns tokens for completing tasks. Once they earn 5 tokens, they get to exchange them for 5 minutes of iPad time. In this system, the iPad time is the A. Conditioned reinforcer, B. Primary reinforcer, C. Backup reinforcer, D. Token. Answer C. Backup reinforcer. This question is about the different parts of a token economy system. The tokens themselves are conditioned reinforcers. They gain value because they are paired with access to something the client really wants. The items or activities that the client exchanges the tokens for are called the backup reinforcers. These are the actual rewards that maintain the whole system. Primary reinforcers meet biological needs. The token is the learned reinforcer, but what you get for the tokens is the backup. Think of tokens like money. You don't want the money itself, you want what you can buy with it. The things you buy are the backup reinforcers. Question 2. A client screams when you present a difficult task, and you remove the task, leading to the screaming increasing. A client also screams when their parent is on the phone, and the parent immediately gives them attention, leading to that screaming increasing. Which scenario is most likely to be labeled escape function in an FBA report? A. Screaming when the parent is on the phone. B. Screaming when you present a difficult task. C. Both are escape function behaviors. D. Neither are escape function behaviors. Answer B. Screaming when you present a difficult task. This question is tricky because screaming happens in both scenarios, but the function is likely different based on the consequence. The first scenario describes the screaming resulting in the removal of a task, likely aversive/unpleasant, which increases the behavior. This is classic negative reinforcement, often linked to the escape function. The second scenario describes screaming resulting in parent attention, which increases the behavior. This is classic positive reinforcement, often linked to the attention function. While both behaviors are reinforced, the FBA would likely label the first as escape maintained and the second as attention maintained. If the behavior helps them get away from something, it's likely escape. Question 3. You are tracking a behavior using a discontinuous measurement method. Your datasheet has many intervals marked yes, but the behavior only occurs for a few seconds within each interval. What measurement method are you most likely using? A. Whole interval recording. B. Momentary time sampling. C. Partial interval recording. D. Duration recording. Answer C. Partial interval recording. This question asks you to identify the measurement method based on how the data looks and the nature of the behavior. The clue is that you're marking yes frequently, even though the behavior is brief. Only occurs for a few seconds within each interval. This pattern is characteristic of partial interval recording, where you mark yes if the behavior happens at any point during the interval, regardless of how long it lasts. Whole interval would show mostly no if the behavior is brief. Momentary time sampling only catches behavior happening at the very end of the interval. Duration measures how long, not just if it occurred in an interval. Partial interval overestimates the total time but is practical for high rate or brief behaviors. If the behavior just has to touch the interval to count, it's partial interval. Question 4. An RBT's ethical code requires them to operate within their defined role and competencies. Which of the following actions would violate an RBT's scope of practice? A. Collecting preference assessment data as instructed by the supervisor. B. Suggesting a minor modification to a teaching program to a colleague. C. Implementing a crisis management procedure as trained and documented in the client's plan. D. Documenting session notes, including objective behavior data. Answer B. Suggesting a minor modification to a teaching program to a colleague. This question is tricky because it involves a seemingly small action, while implementing plans, collecting data, and following crisis procedures are within the RBT's scope. A CD, suggesting any modification to a program, even a minor one, is outside the RBT's role. RBTS are implementers, not designers or modifiers of treatment plans or programs. All changes to programs or plans must be made or approved by the supervising BCBA/BCABA. Suggesting changes to a colleague implies you have the authority to make or recommend changes, which you don't. Any clinical suggestions should go to your supervisor. Even small changes to the plan are a supervisor's decision, not yours or a colleague's. Question 5. A client is taught to say hello when they see you. Later, you notice they also say hello when their parent or sibling arrives. This is an example of A. Response generalization, B. Stimulus generalization, C. Discrimination, D. Maintenance. Answer: B. Stimulus generalization. This question tests the distinction between stimulus and response generalization. The behavior, saying hello, remains the same, but it is occurring in the presence of different people, you, parent, sibling, who are different stimuli. When the same behavior happens across different, but similar stimuli or settings, this is stimulus generalization. Response generalization would be performing different behaviors that serve the same function, like waving or saying hello. Discrimination is responding differently to different stimuli. Maintenance is performing the skill over time. The stimulus, the person arriving, is changing, not the response, so it's stimulus generalization. Question 6. You're tracking a behavior that occurs very rapidly, multiple times per minute, and you need an estimate of how often it's happening. Which discontinuous measurement method would likely be the most efficient and practical? A. Whole interval recording, B. Partial interval recording, C. Momentary time sampling, D. Frequency. Answer: B. Partial interval recording. This question asks you to choose a measurement method suitable for a high-rate rapid behavior that's hard to count every single time, making frequency impractical. Among the discontinuous methods, partial interval recording is often chosen for behaviors that occur frequently or last for short durations. You just have to catch the behavior happening at any point in the interval, which is easier with rapid behaviors than requiring them throughout the interval. Whole, or only at the very end. Momentary, it provides a reasonable estimate of the behavior's occurrence for busy RBTS. When the behavior is fast and furious, partial interval can give you a quick estimate. Question 7. If a client's behavior decreases because it no longer produces the consequence that previously maintained it, what principle is responsible for the decrease? A. Punishment, B. Negative reinforcement, C. Extinction, D. Response cost. Answer: C. Extinction. This question is tricky because both punishment and extinction decrease behavior. However, the key phrase is, because it no longer produces the consequence that previously maintained it. This specifically describes extinction. The behavior decreases because the reinforcement that was making it happen is now withheld. Punishment involves adding an aversive or removing a reinforcer contingent on the behavior, rather than simply stopping the usual consequence. Negative reinforcement increases behavior. Response cost is a specific type of punishment. If you stop giving the behavior its usual payoff and it goes down, that's extinction. Question 8. A client is given a break from a task when they complete a set number of problems, example, every 5 problems. This results in them completing more problems in the future. What type of reinforcement is this? A. Positive reinforcement, B. Negative reinforcement, C. Escape, D. Access to tangibles. Answer: A. Positive reinforcement. This question might seem like escape because a non-preferred task is involved, but look carefully at what is delivered contingent on the desired behavior, completing problems. That makes that behavior increase. Completing the problems, behavior results in getting a break, a desirable activity/state. Since a desirable consequence, the break/access to preferred state, is presented after the behavior, and the behavior increases. This is positive reinforcement. While it involves getting away from the task, The delivery of the break is the consequence that reinforces the completion behavior. Getting access to a preferred state, break, after completing work is positive reinforcement for completing the work. Question 9. You are preparing to teach a new skill using a task analysis. Your supervisor asks you to collect baseline data using total task presentation. This means you will A. Prompt the client through all steps of the task analysis and reinforce the last step. B. Present the opportunity to perform the entire task and record which steps the client completes independently. C. Present each step of the task analysis individually and record if the client can do it. D. Only collect data on the first step of the task analysis. Answer. B. Present the opportunity to perform the entire task and record which steps the client completes independently. This question asks about collecting baseline data using a total task approach. When collecting baseline for a task analysis using total task, you give the instruction to perform the whole task and see which steps the client can do on their own without prompting. You don't prompt through it, A. Although you might guide them if needed, but you wouldn't reinforce completion in baseline. Presenting steps individually, C, is a different baseline method example probe. Data on only the first step, D, isn't total task. Total task baseline means assessing the whole task as the client would normally perform it. Let them try the whole thing on their own and see what they can do. Question 10. What is the most appropriate way for an RBT to respond to feedback from their supervisor? A. Politely explain why your approach was correct. B. Listen carefully, ask clarifying questions, and implement the feedback. C. Defend your decisions by highlighting challenging aspects of the case. D. Thank them and state that you will consider their suggestions. Answer. B. Listen carefully, ask clarifying questions, and implement the feedback. This question is about professional conduct and utilizing supervision effectively. Receiving feedback is a core part of being supervised. The most professional and beneficial approach is to actively listen to the feedback, ask specific questions if you don't fully understand it, and then make a genuine effort to apply that feedback to your practice. Options A and C are defensive and dismissive of the supervisor's expertise. Option D is passive and doesn't commit to implementation. Supervision is your chance to learn and improve. Take the feedback seriously and use it. Question 11. A client usually screams when you put broccoli on their plate. The screaming causes you to remove the broccoli. This results in screaming increasing. From the client's perspective, the removal of the broccoli is functioning as A. Positive punishment. B. Negative punishment. C. Positive reinforcement. D. Negative reinforcement. Answer. D. Negative reinforcement. This question is another tricky reinforcement/punishment scenario focusing on the client's perspective. The behavior is screaming. The consequence is the removal of broccoli. Something unpleasant is taken away. Negative. The behavior, screaming, increases reinforcement. Therefore, the removal of the broccoli is functioning as negative reinforcement. The client is reinforced for screaming by getting away from the unpleasant food. Getting rid of something they dislike makes that behavior, screaming, happen more often. Question 12. You are collecting data on a client's eye contact during a teaching program. You record if eye contact occurs at the very end of a 10-second interval. What measurement method are you using? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Frequency. Answer. C. Momentary time sampling. This question asks about a specific discontinuous measurement method. The crucial detail is checking at the very end of a 10-second interval. This defines momentary time sampling. You are taking a snapshot of whether the behavior is happening at the precise moment the interval ends. Whole interval requires the behavior throughout the interval. Partial interval requires it at any point in the interval. Frequency counts occurrences. If you check only at the beep of the timer, it's momentary time sampling. Question 13. Which ethical principle requires RBTS to avoid causing harm to the client? A. Beneficence. B. Non-maleficence. C. Fidelity. D. Integrity. Answer B. Non-maleficence. This question asks about a core ethical principle. Non-maleficence means do no harm. As an RBT, you have an ethical responsibility to avoid causing any physical or psychological harm to your client. Beneficence means doing good. Fidelity means being loyal and trustworthy. Integrity means being honest and truthful. The principle directly related to avoiding harm is non-maleficence. First, do no harm. Question 14. When conducting a paired stimulus, forced choice, preference assessment, how many items are presented to the client at a time? A. 1 item. B. 2 items. C. All items in the assessment. D. A randomly varying number of items. Answer B. 2 items. This question asks about the procedure for a specific type of preference assessment. In a paired stimulus or forced choice assessment, items are presented in pairs, and the client chooses one from the 2 options. This is done for every possible pair of items in the set being assessed. Single stimulus presents one at a time. Multiple stimulus methods present several items at once. The name paired stimulus or forced choice is your clue. You are forcing a choice between a pair of items. Question 15. You are working with a client on a skill acquisition program for greeting others. The program specifies using a model prompt. This means you will A. Tell the client, say hi. B. Physically guide the client's hand in a wave. C. Point to another person saying hi. D. Wave and say hi for the client to imitate. Answer D. Wave and say hi for the client to imitate. This question tests your understanding of a model prompt. A model prompt involves the RBT demonstrating the target behavior, or a close approximation, for the client to imitate. Options A is a verbal prompt. Option B is a physical prompt. Option C is a gestural prompt combined with a verbal prompt. Showing the client exactly what you want them to do or say is providing a model. Question 16. What is the purpose of using errorless teaching? A. To prevent the client from making mistakes, allowing them to contact reinforcement frequently. B. To teach the client how to learn from their errors. C. To make sessions shorter. D. To reduce the need for reinforcement. Answer A. To prevent the client from making mistakes, allowing them to contact reinforcement frequently. This question asks about the goal of a specific teaching strategy. Errorless teaching is a method where prompts are used to ensure the client responds correctly almost every time, especially during the initial stages of learning a new skill. The goal is to prevent errors, which can be frustrating or lead to learned incorrect responses, and to ensure the client experiences frequent reinforcement for correct responses. This helps build momentum and makes learning more enjoyable and efficient. Errorless teaching is about minimizing errors so the client gets reinforced more often. Question 17. When referring to a client's challenging behavior in documentation or discussions with your supervisor, you should A. Use subjective labels like he was just being stubborn. B. Describe the behavior using objective, observable, and measurable terms. C. Focus on what you think the client was feeling. D. Use the client's diagnosis as the primary description. Answer B. Describe the behavior using objective, observable, and measurable terms. This question reinforces the importance of objective language in professional communication and documentation. When discussing behavior, whether in notes or with your supervisor, you must describe what you saw and heard using objective terms that are observable and measurable. Example, hit head with open hand. Screamed loudly for 5 seconds. Subjective labels. A. Feelings. C. Or diagnosis. D. Do not provide the specific information needed for accurate analysis or consistent intervention. Be a good scientist. Describe what you can observe. Question 18. If a client is learning to identify objects by touching them, when you say their name example, you say, touch car. They touch the car. This skill falls under which category of verbal behavior? A. Mand. B. Tact. C. Echoic. D. Listener responding. Answer: D. Listener responding. This question asks about a specific category of verbal behavior based on B. F. Skinner's analysis. The client is listening to a verbal stimulus, you saying the object's name, and then performing a non-verbal response, touching the item. This is the definition of listener responding. Manding is requesting. Tact is labeling, saying the name when seeing the object. Echoic is repeating. Listener responding is all about following instructions or reacting non-verbally to what is said. Question 19. Your supervisor asks you to collect data on the time between the end of one instance of hitting and the beginning of the next instance of hitting. What dimension of behavior are you measuring? A. Duration. B. Latency. C. Interresponse time, IRT. D. Frequency. Answer: C. Interresponse time, IRT. This question asks about a specific time-based measurement focusing on the gap between behaviors. The phrase time between the end of one instance and the beginning of the next instance defines interresponse time, IRT. Duration measures how long a single instance lasts. Latency is time from a cue to the behavior starting. Frequency is the count. IRT measures the time between two occurrences of the same behavior. Question 20. When thinning a reinforcement schedule, you are making the reinforcement contingency. A. Stronger by providing more reinforcement. B. Weaker by providing less reinforcement. C. Easier to meet by requiring fewer responses. D. More predictable by using fixed schedules. Answer: B. Weaker by providing less reinforcement. This question asks about the effect of thinning a reinforcement schedule. Thinning means moving from reinforcing a behavior frequently, like C or F, to reinforcing it less often, intermittent schedules. This makes the behavior contingency weaker in the sense that each individual response is less likely to be reinforced, although the overall behavior rate may remain high or even increase because the behavior is more resistant to extinction. It doesn't necessarily mean using less amount of reinforcer, A, but requiring more effort/time per reinforcement. It makes it harder to earn, C, and often involves less predictable variable schedules, D. You're getting less payoff for each single behavior, making the reinforcement leaner or weaker on a per-response basis. Question 21. What is the most critical role of the supervising BCBA or BCABA in the RBT's practice? A. To provide direct therapy services alongside the RBT. B. To oversee the RBT's work, provide training, and make all clinical decisions. C. To manage the RBT's schedule and payroll. D. To handle all communication with the client's family. Answer: B. To oversee the RBT's work, provide training, and make all clinical decisions. This question highlights the essential function of the supervisor. The BCBA/BCABA is legally and ethically responsible for the services provided by the RBT. Their critical role is to design the treatment plan, train the RBT how to implement it correctly, provide ongoing supervision and feedback, and make all clinical modifications and decisions based on the data the RBT collects. While they might sometimes provide direct therapy, A, or assist with communication, D, their core responsibility is clinical oversight and decision-making for the case and the RBT's work on it. Your supervisor guides everything clinical. Question 22. If a client's challenging behavior is occurring because it helps them get out of doing a non-preferred activity, what function is most likely maintaining the behavior? A. Attention. B. Access to tangibles/activities. C. Escape. D. Automatic reinforcement. Answer: C. Escape. This question is a direct test of identifying the escape function. The phrase helps them get out of doing a non-preferred activity, clearly points to the escape function. When a behavior's consequence is the removal or avoidance of an unpleasant task, situation, or stimulus, and this increases the likelihood of the behavior happening again in similar situations, the function is escape. They are engaging in the behavior to get away from something they don't like. Question 23. What is the purpose of a task analysis? A. To identify potential reinforcers for a client. B. To determine the function of a challenging behavior. C. To break down a complex skill into smaller, manageable steps for teaching. D. To measure the frequency of a behavior. Answer: C. To break down a complex skill into smaller, manageable steps for teaching. This question asks about the purpose of a specific assessment and teaching tool. A task analysis, TAE, is the process of taking a complex skill, like washing hands or getting dressed, and breaking it down into a sequence of individual, smaller steps. This makes the skill easier to teach and measure progress on. Preference assessments: A. Find reinforcers, FBA. B. Determine function, frequency. D. Is a type of measurement. A task analysis breaks big skills into small pieces. Question 24. If a client engages in a behavior and, as a result, something they dislike is added to the environment immediately after the behavior, and this causes the behavior to decrease in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: C. Positive punishment. This question asks you to identify a consequence that decreases behavior by adding something unpleasant. The clues are causes the behavior to decrease in the future, punishment, and something they dislike is added immediately after, positive. When you add something aversive after a behavior, and it makes the behavior less likely to happen again, it's positive punishment. Positive means adding, punishment means decreasing. Question 25. When deciding which skills to teach a client, the most important consideration should be A. What skills the RBT finds easiest to teach. B. What skills the client's parents want taught, even if they aren't prioritized by the supervisor. C. Skills that are socially significant and relevant to the client's life and development, as identified by the supervisor. D. Skills that are the least challenging for the client to learn. Answer: C. Skills that are socially significant and relevant to the client's life and development, as identified by the supervisor. This question addresses a core principle of applied behavior analysis, focusing on socially significant behaviors. ABA aims to make meaningful improvements in a person's life. Therefore, skills chosen for teaching should be relevant and important for the client's independence, social interactions, daily living, and overall quality of life, as determined through assessment and prioritized by the supervisor in collaboration with the family. It's not based on RBT preference, A. Solely parent preference outside the plan, B. Or just choosing the easiest skills, D. Focus on skills that make a real difference in the client's life. Those are socially significant.